Hi, this video is the hair transplant. Um, this client had a procedure done at a clinic that claimed that they work on an African American hair, but unfortunately, it doesn't turn out correct. And what they did is they used a technique with a lot of mini plugs, and you can see a lot of dimpling and a lot of plugginess. I know it's kind of hard to see, but if I zoom in a little bit closer for the audience to see, and it's all the front. It's not just poor. There's quite a bit of thing wrong with this. Number one, they did the head. A lot of plugs, number one, and you shouldn't be having plugs for this kind of work, especially around nowadays. And on top of it, for African plug with straight thin hair, you might probably can get away with it, but for black curly hair, that's one of the worst things because it's very visible. Number two, plugs, mini plugs, and all this stuff can cause more scarring and dimpling, and that's that. And number three, this is very poor density for this client, and so they claim to do 3,000 or 4,000 grafts, but they put in hardly anything grows. So it's utmost important that when you research about the clinic that's claimed that work on African black curly hair, you don't want to see 6 months result. You want to be able to see a full year result later, because sometimes they film 3 months or 4 months, 6 months, and it looks decent growing in, but you want to be able to wait until a year to have a really true result of it, and that's more important. And for me, I've been a specialist in black curly hair for almost 15 years. This is I've been a specialist and working on using the FUE method or the FUT method. And how do you know the clinic or the surgeon specialized? Just look at the before and after, look at a lot of the result, and then you understand the density. It's not how many books I write or how many degree I have on my wall. Is how much I can show what's the before and after, because this can be very devastating for you and it affects your life. And you definitely do not want plugs in front forehead, do not want to have scarring. And on top of it, now the hair density growth is so poor, it's like 10%, I believe, that if he cut it short, the plugs is be visible and scarring. If he leave it long, it won't grow. So for him, if he, unfortunately he lived far, but if he can come back, see a year later, I'm pretty positive that once I finish with his work, he can have a very good coverage, good density, and it will grow out, and then have a very nice hairline as well. We're going to be attempting at least 3,000, but seeing him in person, he's probably going to need around 3,500 or 4,000. But even 3,000 might work and going to be way better than what you see here. And again, stay tuned, and I will try to hide his plugs by transplant baby hair in the front, and then transplant through these plugs. And the reason why we didn't get rid of some of this, unless it's too harsh, because there's too many of them that if I FUE out, there's a lot of scarring involved, and you don't want that. But I feel confident enough that if we transplant a lot of density throughout, and they're blending with these mini plugs, then you're not going to see that bad, unless it's so obvious and it's so off the hairline. Then I will thin it out. But I think this part, there will be some FUE thinning out, but there's a lot of transplant throughout, and then a lot of refix the hairline to make it look natural. And so it's a project. It's not easy to do, but this is what I love to do. And I prefer to work on a plain canvas where I never had it done, and then it's easier. But I fix a lot of other people's work as well. And so this, stay tuned, and hopefully he can come back and show the audience that a year later, I'm very confident we're going to give him very good density and good result. So this is the hair transplant on a client who had plugs and with poor density. And thank you.